So this is kind of what the heart looks like. The heart has two valves on the left side, the mitral valve and the aortic valve. The aortic valve gives rise to a big blood vessel that goes off to give blood to the rest of your body. Left atrium is where the vessels coming from your lung come back to the heart. This is the mitral valve. This is the aortic valve. This is the right side of the heart, and this is what the heart muscle looks like. So the mitral valve attaches to the heart through these cords or strings that go down and connect to the heart muscle itself. When the heart contracts, this valve normally closes and that valve opens. And blood that's coming in from the lungs gets pumped out to the aorta, out to your body. And so instead of the valve meeting normally in the center, this one goes up. And so blood is, instead of going straight out of your heart, is going backward towards your lung. Now what happens is this blood leaks back, the pressure in this chamber goes up. Atrial fibrillation is a problem where that can lead to a number of problems, such as stroke and problems with your heart muscle, the strength with which your heart muscle can contract. The pressure in the lungs goes up, and as it gets bigger, this valve gets stretched, and then this valve can leak. And that is something that we can often address at the time of your surgery to try and address all of these problems in one setting. So oftentimes we're doing operations where we repair the mitral valve, do a procedure, an ablation procedure to box those bad lesions to the back of the heart so they can't affect your normal heart rhythm, and repair this tricuspid valve so in the future you don't get problems on the right side of your heart. In addition to that, some patients have problems where the arteries have disease in them. And these are the arteries that come off of the main blood vessel and they go around and give blood supply to the heart muscle. And in those patients, if they have blockages in these arteries, we're doing bypass surgery in order to bring more blood supply to the heart, using an artery that runs on the chest wall called the internal mammary artery, or saphenous vein, which we take from the leg and connect from the top part of the heart to the blood vessel beyond the blockage. And what this allows is for us to get more blood supply to your heart if you have artery disease, repair the valve that's causing the main problem, address the problems that come from that valve being diseased, like the heart rhythm problem, AFib, and the tricuspid valve problem.